Hey guys, and welcome to this week's episode of Meds
Meds.
Kids Edition.
Hey guys, welcome.
So we have Sam, who is 11, and Grace, who is 9, and they are joining us this weekend, Meds, to ask some questions that maybe some kids have regarding coronavirus. We are live.
We are live.
Can you believe it?
Yes. Throughout the whole world, broadcast to the whole world.
All right, so Grace, you have a question you want to ask us?
Sure.
What's your question?
When will quarantine end?
When will it end? Oh my
When?
gosh. I can sense that you really want it to be over.
Uh-huh.
So,
Why don't you like quarantine?
they miss their friends.
Yeah.
We
Right,
can't go anywhere.
I
right.
know.
So we don't really know when quarantine will end. We hope that Illinois' stay-at-home will end at the end of May, but you probably will still have to practice social distancing and being careful around people. Sam does
People
not
say
think it will
it
end in May.
People say it will end in 2024.
Oh.
2024. Oh no, I hope not.
What can we do for now if quarantine can't end?
Well, you can go outside
Get some
and
exercise?
you can play. You can see your friends, but not hugging. But get some exercise, run around. Do you guys like to dance?
Yeah. Sure.
So you can do some dancing outside with your friends?
No, we don't dance outside.
Do you throw? Oh, you can't dance outside?
What kind of
Do you have a problem
activities-
with that?
What
Oh
kind
my
of
gosh,
activities do you like to
Gracie.
do? So we mostly brought Sam here because she's our biggest fan. She watches us every week, and she brought her sister along just for fun and comic relief. But Sam, you wanted to ask us a question. What's your question?
How do kids deal with anxiety?
And what does anxiety mean to you?
Being stressed.
And how do you feel when you're stressed?
Like my stomach hurts and my heart starts pounding really fast.
Yeah. So Dr. Beckman, as a pediatrician, what do you say?
Well, what are things that you like to do?
Like
Play? What kind of things do you play?
volleyball, basketball.
Outside, get some exercise, some fresh air.
Do you like to listen to music? So listening to music, dancing, playing outside.
So when you feel anxious, what do you do? Like take a moment away to kind of relax and breathe?
Sometimes.
I think it's normal to feel anxious during this time because you're cooped up in your house and you don't really know how to feel.
You're gonna lose your mind.
Right. I think people need to go outside and get some exercise in the fresh air.
Do you like yoga? Have you ever done that?
Grace likes it. I don't.
Oh.
Or sometimes, what else does Grace like to do? Grace loves TikTok.
Sure.
To be continued in the bloopers. So we got rid of our little friends. They were great, rambunctious little children that were excited to finally leave their house. Who can blame them? So we wanted to talk a little bit about pregnant women.
Yeah, so we've had some questions submitted to us. And one of the questions was, I think one of the themes is people are afraid to come into the office and they're wondering, is it safe enough? So one of the questions that we had was from a patient who is pregnant and I believe in her 3rd trimester, and she's wondering about a home birth. Would that be safer for her instead of going into the hospital? So what do you think?
Right, so we have had a lot of questions actually from pregnant patients that have asked, would you be my midwife at home? Number 1, no is the answer, because as the midwife working for this practice, I only deliver patients in the hospital. Usually a midwife who delivers patients at home has her own business and sees patients throughout their prenatal care at home and then chooses to deliver that patient at home. Home births are reserved for really low risk patients. Remember, there's no medication at home. There's no induction medication. There's no pain medication. So it's not a bad idea, but it's also not the right type of delivery for many, many people. We are hoping to take all the right precautions. Most hospitals are screening people before they get to the hospital. Not all though, to see if that they have coronavirus before they get to the hospital, or once they get there, they'll screen you and test you even with a swab. So we try to do everything we can to be as safe as possible in the hospital. We limit how many people are in the hospital. Moms are only allowed to bring one guest. There are no visitors while you're there. So we hope that it is a safe option for most mothers, and we think that overall it's probably a more safe option for most people than having a member.
Yeah.
Remember, we still want people wearing masks. Please, again, as always, stop wearing gloves so that you stop touching everything. Just wash your hands.
Just wash your hands.
Practice washing your hands.
Please, just wash the hands.
No gloves. But we do want people to wear masks. And here in Illinois, we are required to wear a mask, which I think is great. I think in other states where people are not required to wear a mask, it could put other people at danger
Right.
of becoming infected from someone. So I think it's great to continue wearing a mask. A lot of people are wondering, what is the difference between a regular hand-sewn mask, a bandana, versus a hospital-grade mask? We're not saying N95. Obviously, we know that N95s are keeping everything and anything out for the most part. But what is the difference between an office-given, surgical mask versus a mask that someone sewed for me?
Sure. Well, some of those surgical masks, they can filter out smaller particles, so smaller viral particles. But the main reason for wearing a mask or any facial covering is because some of the large droplets that come out when you're singing or yelling or speaking closely to somebody can contain the virus. So if you have a mask, that will prevent those particles from landing on a table, landing on a surface that someone else can touch and then infect themselves with. So the mask wearing is actually more about preventing the spread to other people and not really preventing you from getting sick. The N95 masks and those high-level surgical grade masks are usually for healthcare providers that are really close to patients who are sick and preventing them from getting sick from those patients. But in the general public, those facial coverings are mainly to protect other people. So you may have virus and you may be sick and not have any symptoms, but by wearing that mask, you're not spreading any of those germs to other people unknowingly.
And the nice thing about cloth masks, even though you're not spreading your germs to others, you can take them home and wash them. So we recommend that, if you're out and about all day, especially, you bring it home and you wash it. You don't just keep that same mask over and over again. You can wash it just like your clothes.
And you can get creative.
And wear cool masks.
You can wear cool masks, like shiny ones with sequins.
Right, bedazzled masks.
Yeah.
It'll be the next thing. Some people have been putting off annual exams. Some people have asked us, what if I'm due for a pap smear or an annual exam? I would say if you have had normal well-being checks and have no comorbidities, no issues, no high blood pressure, diabetes, asthma, no abnormal pap smears, maybe you could put off those exams for a little bit. But now we're kind of going on month 3 of putting things off. At what point should people come in? We've had a lot of questions, especially from parents asking, bringing in their children, putting off vaccines. How long can we do that?
Yeah. Well, in the beginning, we didn't have a good grasp on what this virus was. We didn't know how widespread it was. But now that we've seen numbers go down in terms of the number of people that are positive for coronavirus, what we want to do is bring patients back safely into the office. And we've taken a number of precautions. We don't have any sick patients coming into the office. We are limiting the number of people that are in the waiting room. We're cleaning and sterilizing all the surfaces in each room after each patient leaves. And myself and Anne Scaletti and Marissa, when we examine kids, we have a mask and we're wearing gloves. So we take all those precautions, and at this point, we actually do want you to schedule your well child visit, and we want you to come in and get the vaccines because those other illnesses are still in the community, and those vaccines are needed to prevent your children from getting sick from other things. So we're taking all the precautions that we need to up to this point so that you don't get exposed to coronavirus. but you also need to get those shots.
Right. So if you are really worried about it, or if your own child's pediatrician or your own doctor is closed, you can always set up a video visit with any of us, meet with us via video, and then be one of the first patients of the day to make you feel a little bit better. But definitely, I would agree that we are taking all of those precautions and still hope to see our regular patients and even new patients if they're looking for a place to go. Bye, everybody! Thanks, special guest.
Thanks, guys.
We'll miss you.
Bye.
Let's go. Coronavirus has us doing things out of our comfort
Where are
zone.
you going?
We lost one. She'll be back. We are doing things that we're not normally used to doing, but we discussed that TikTok is a form of exercise because it's a form of dancing. Okay, we're gonna learn some TikTok moves. Ready?
Grace, you can
What's the
lead.
first move?
I'll do it. Oh.
What's the first move?
You're going ahead. Oh my god.
Can we do some like jumping jacks exercises? Not cool. Okay, what else? Can we see David Beckman do that? What else? I'm not sure what that was. What about some like physical activity? You could like.
Can you do a backbend? No.
Can you?
You
You do it.
I'll
Do it.
squat. I'm scared.
Okay.
I'm scared. I'll squat.
Ready?
How about,
This way. In the
Oh my
camera.
I can see.
yeah.
I got it.
Woohoo!
I can do
Down for the count.
Nice.
Calm ourselves down, guys. It's not the end of the month yet. What is it? You.